It started with one man and his dream: to prevent unnecessary blindness and restore eyesight to millions of his countrymen and women. When Dr. Govindappa Venkataswamy started Aravind Eye Hospital in the Indian city of Madurai in 1976, it had 11 beds. Today, it has clinics and hospitals throughout India and is the largest cataract facility in the world. Dr. Venkataswamy passed away in 2006, but his work lives on. The evidence: tens of thousands of Indians who have been given back the gift of sight. Sundaramba is from a poor village near the city of Pondicherry. The 55-year-old can't afford the cataract surgery she so desperately needs. Her neighbor, 60-year-old Abdul, is in the same boat. But Aravind is committed to providing the best eye care available, regardless of a person's ability to pay. So both will have their cataract operations free of charge. Today, they've come to one of the hospital's mobile village units for examination, diagnosis, and counseling. Later, they'll be taken by bus along with 50 others to the base hospital in the city, where they'll stay until their operations are completed and they've had time to recover. It's a journey both have made before.
I already had the first eye done and the surgery was great. I'm glad to be getting the other one done.
I'd been working as a watchman for 18 years when I started having vision problems. It affected my job. I had my left eye operated on and it's fine now, though I've been having problems with my right one, and today the doctors recommended more surgery.
Basically, the Aravind is going to the community, so we need the participation of the community.
The women in this ward were brought to the base hospital from villages visited by Aravind's staff and are now recovering from their cataract surgery.
We came to this hospital because it has a very good reputation and we are happy with the result.
They are provided with food, beds, free counseling, and transport to and from their communities.
There are often mobile camps from Aravind in our village. This time they identified 32 patients and brought us all here to the hospital. They've treated us very well and the operation was a success. We'll be going home tomorrow.
Aravind uses the fees from its paying customers to subsidize the costs of surgery for poor people, who make up 70% of its patients. In order to do this cost-effectively, staff must work quickly and efficiently. Ophthalmologists here can perform up to 50 cataract operations a day, a tally their Western colleagues find mind-boggling. This high-volume, high-quality, low-cost business model has helped to make Aravind 97% self-supporting, along with its remarkable use and application of technology.
Information technology is well developed in India, so we thought that whether we could make use of that information technology part in mobilizing these rural patients to the urban surgical centers.
This cramped village clinic may seem an unlikely poster child for state-of-the-art technology, but in its cavernous back room, a mini revolution is underway. People from the village who could not afford to travel to the city receive examinations. Then digital photographs of the blood vessels in their eyes are uploaded directly to an ophthalmologist at Aravind's Madurai hospital. With the help of a technician and a broadband connection, the ophthalmologist is able to view the photographs, make a diagnosis, and consult directly with the patients. Ophthalmologists in the base hospital often carry on up to 5 consultations at once using this system, which Aravind refers to as its McDonald's model. In 1992, Aravind set up its own manufacturing division, Orolab, which produces a range of products, most notably intraocular lenses for cataract patients. At the time, these lenses cost more than $200 on the international market. Aravind researchers determined that by mass producing the lenses themselves, they could bring the cost down to around $10 a unit. They sell lenses they do not use themselves, which helps support their activities.
This model can be taken up to the entire country and the global level, all this level, because it is self-supporting. And
Prathmesh Mehta is doing postgraduate work at Pondicherry Hospital for 2 years before he returns to his hometown in the north of India. Realizing the ongoing need to invest in human resources, Aravind mentors both Indian and international students through its relationships with colleges and universities.
I myself am seeing around 50 patients a day with all kinds, from cataract to glaucoma to retina to cornea, all kinds of patients daily. So it's a very good patient exposure.
Dr. Venkataswamy started small, but he dreamed big. He lived by the ethos that intelligence and capability are not enough. There must also be the joy of doing something beautiful. The joy and beauty of giving people back their sight is his legacy, one that lives on in India and around the world, thanks to Aravind. Its dedicated staff, its commitment and philosophy, and its practical, innovative, and ever-evolving dynamism.